The call to DMC resulted in saving my life. I woke up about 1 o'clock in the morning. I had excruciating pain. The next thing I remember, I'm laying on the bedroom floor and I could hear my wife talking to the EMS. I had what was called a type A aorta dissection. They told my wife that they couldn't do anything for me. I found out later they called around to 3 other hospitals and nobody would admit me. Then they called Detroit Medical Center.
Mr. Cabades was rejected by the hospitals mostly because of his age. He's 85 years old. At the Detroit Medical Center, we like to assess the patients on an individual basis, not based on their age. Type A dissection is a disease process. If not treated within 2 days, can lead to heart attack, stroke, or death. The mortality rate is 2% every hour, so time is of the essence.
I could feel the helicopter descending, and it landed here at DMC, and this unknown doctor, Dr. Terasaki, the surgeon, he was waiting for me. They cut a section of my aorta out that had a 3/4 inch tear and put in a synthetic tube in there, and they sutured it to my existing aorta.
No heart surgery can be done alone by the heart surgeon. We have a whole team, and it's an incredible feeling to be part of that group.
The care I got, the nurses, aides, all the help, they were absolutely wonderful, really. I would give them a 5-star recommendation, and Dr. Terasaki a 6-star recommendation. The best thing I ever did was agree to go to the Rehabilitation Institute of Michigan here at DMC. They're always trying to encourage you to get better. They're not nurses. They're God's little angels, okay? That's what they are. They did such a good job that I exceeded all of their requirements in about half the time. With the DMC on my side, I know that I will have many more years with my family.